to start off by acknowledging that I am meeting with you today from the unceded territories of the Lekwungen speaking people, the Songhees and Esquimalt nations, also known as Victoria, and I am a Scottish settler and uninvited, but so grateful to be here. To start my story, I'll just say that I was initially involved in the earlier 2000s and then up into 2015 with the Canadian Center on Substance Use and Addiction and this Canadian Community Epidemiological Network on Drug Use. And we were doing a little bit of early warning monitoring and surveillance, and ended up coming together to issue a bulletin about deaths involving fentanyl in Canada. I think we did that around 2015, and we covered off the deaths between 2009 and 2014. It was becoming quite apparent then that fentanyl was entering the drug supply and becoming and superseding the prescription opioids and heroin as the main drug. So I just want to tell that piece as well. As you know, we were doing some early warning and surveillance. And then in 2016, for the very first time in Canada that we know of, there was a provincial health officer, then Dr. Perry Kendall, served notice under the Public Health Act to exercise emergency powers and to take action in response to this growing crisis. And before the declaration of the public health emergency, information on overdoses were only reported if someone died, and there was quite a delay in this information. So this declaration allowed for medical health officers throughout the province and health authorities to collect more robust and real-time information on overdoses, and to identify and strengthen actions such as naloxone distribution and new actions, which also included a ministerial order for health authorities to rapidly set up overdose prevention services. The other thing that happened was in 2017, the Ministry of Mental Health and Addictions was formed in BC with two main functions. First, to improve access and quality of mental health and addiction services for all British Columbians. And then the second main responsibility was to develop an immediate and escalated response to the overdose crisis and emergency. And then late into December, the Ministry of Mental Health and Addictions launched the Overdose Emergency Response Center. And its main mandate is to coordinate a provincial response to the overdose emergency. So the Overdose Emergency Response Center, it spearheads this urgent action, and it consists of a team of core experts like Guy and clinical nurse leads and project management staff and experts to coordinate the response across the province. We work closely with 5 regional response teams and 35 community action teams to coordinate and strengthen the response on the ground. And to work, of course, closely with other jurisdictions regionally and with municipalities as well, all to support a system response to making improvements. I tell you a little bit about the community action teams. So those were established in communities identified as having the most highest need and risk of overdose. And they include groups that are coordinating action on the ground, including municipalities, first responders, frontline community agencies, divisions of family practice, people with lived experience, and Indigenous serving organizations and people. The other piece I want to tell the story about is a little bit about the comprehensive package of interventions. So in the fall of 2017, there was a group of people that came together with taking lessons from the Pan American Health Association, the World Health Organization, who had taken a comprehensive package approach to HIV at the time. And so utilizing that sort of model, we applied this evidence-based intervention approach and created a package that would ultimately guide all of our work to escalate the response to the overdose emergency. And this comprehensive package includes a set of essential health sector interventions, and that includes take-home naloxone, which we do and is coordinated through the BC Centre for Disease Control, overdose prevention services. So I had highlighted that with the ministerial order that came down, ordering health authorities to open up these supervised and overdose prevention services. And that includes other services like drug checking and safer supply. And then we also had acute overdose risk case management, which is about, robust data and surveillance, and then working with frontline service organizations to rapidly refer and connect people to harm reduction and treatment services. And then we had treatment and recovery work that we have been improving access to, including low barrier access to things like opioid agonist treatment. And we know a combination of this package of at least naloxone, overdose prevention services, supervised consumption services, and increasing access to opioid agonist treatment we know based on some mathematical modeling done by Dr. Mike Irvine with the BC Centre for Disease Control, has averted since 2016, since the declaration of public health emergency, over 6,000 deaths. The other piece about the comprehensive package is more of a longer term game, and that's the essential strategies for a supportive environment. And that's including social stabilization and ensure access to housing, income assistance, transportation. And we also have peer empowerment and employment, providing activities, support for peer coordination activities, peer drug user networks across the province, and working with people with lived experience, and cultural safety and humility, working closely with the First Nations Health Authority and Métis Nation BC on escalating the response. And the First Nations Health Authority has their framework for action for addressing the public health emergency. And then the last one is the addressing stigma, discrimination, and human rights. And we've been doing a few projects there in partnership with municipalities and other Pivot Legal Society to look at a rights-based approach to that. We've been doing a fair amount of stigma reduction work through our public awareness campaign, and we have a Stop Overdose website as well. So I think at this point, I'd like to turn it over to Guy just to talk a little bit about his role within the OERC and our work with peers.